Good morning. Today we are with Dr. Jobo Eala. Hi Jobo, good morning.
Good
Welcome
morning,
and
doctor.
thanks
Buenos
to be
dias.
with us. Buenos dias.
Buenos dias.
Jobo is a plastic surgeon from Manila, Philippines, and we are just about to finish our 5 weeks,
5 weeks.
together.
Yes.
Time flies.
Time flies by so fast, doctor. And I can't believe it's been 5 weeks already.
Yeah, you're right. It's always the same. Jobo, you saw everything we do in the clinic and in the OR. Would you mind sharing your experience, your thoughts?
So, coming here as a plastic surgeon from the Philippines, it was a new environment, but everyone in Team Romeo Aesthetic Group was very welcoming. Of course, you, Doctor, Dikra, Mary, Christina, Viviana, all the nurses, staff, and anesthesiologists were all very much welcoming, and I appreciate that. Okay, so I learned a lot of techniques, tips and tricks in the operating room. It further strengthened how to be efficient with your time and maximizing what you have. The equipment that you have, you just maximize it. But beyond that, beyond the operating room and beyond everything in the OR and what we do, the most important thing that I learned outside the OR was that number one, you take care of your practice and your brand and your name. Number two, you take care of the people you work with. And number three, and most important, you take care of your patient. And that was one thing that I will never forget because you imparted that in me every day from our pre-op consults and then the operation and post-ops. You really taught me that, and I appreciate that, and that is something I will take home to the Philippines. Yeah.
I think you touched a very important point, Jobo, because techniques is something you learn. Of course, you cross the world also to learn what we actually do manually. But I have the same thought. Myself, I learned from people when I did my fellowship that people scare. When I mean people, I think you nailed it. It's about your team, your patient, of course, primarily. And caring about people is the most important thing. Do you know why? People, one more thing, I don't know, we discussed about a little bit before, but at the end of the day, doctors miss to understand that this is an emotional job. We deal with emotions. Do you know that?
Yes. When we deal with emotions, we deal with patients who are easier to deal with, but we also have patients who are difficult to deal with, and people who are, again, easy and difficult to deal with. But you know, doctor, but when I ask your patient, when I talk to your staff, one thing that they say, they love you.
But it's not about being loved, it's about put people at ease, comfortable. So I'm happy that they love me eventually, but it's not about something egocentric, about be the center of everything. It's about if they love me, it's because eventually the real meaning, the important meaning, is that they feel comfortable and safe.
Safe surgery and safe everything.
Remember, we dealt with a couple of a bit anxious person.
Yes.
He thought there were problem. Yeah. There was no problem. Was the normal post-op? But what did we do? Remember, we
calmed them down, and then after the consult, big hug for the whole team. Yeah.
Some doctors, I understand that they are very formal and they don't hug. I don't mind the hug once in a while. How is it in the Philippines?
Patients feel like family.
Okay.
Yeah.
Nice.
So that's one thing that I noticed with the Madrileños, or the Spanish people and Filipino people. They feel like family. Eventually, they become like family because they feel cared for. So that's one thing that's similar, I think, that the care that we both have for our patients and the patients have for us.
Yeah, that's important. That's important because at the end of the day, it's the bond of trust. If trust is bilateral and we sort out everything,
yes.
Even if you have minor things, problem, touch ups,
yes.
Who cares? And from the technical point of view, I think that people might be interested to know what you technically saw from the nose, face, and body. Anything?
Okay, so the facelift technique, first and foremost, the facelift technique is something that really interests me. So our endoscopic procedures, the deep plane technique that you do, the things that are not taught in the book. I learned a lot for the facelift, first and foremost. In the rhinoplasty, using the piezo, using the ultrasound,
the micromotor.
The micromotors, yes, and everything else, or the manual. But again, the most important is the doctor. Yeah. Yes, and then further strengthen what I know in aesthetics, and like I said, what's not taught in the book, I can now apply with the technique that you learned and taught me, and will be refined.
Yeah, of course, you must give your touch, your filter with your experience, and also your personal taste. At the end end of the day, one technique might give different results in different surgeon centers, and that's the beauty part of our job. Plastic surgery is never boring, isn't it?
It's not boring at all. So what anatomy is standard, but not every nose is the same.
Oh, nose is like complicated. So yes, we had I think you were lucky this month. You had exposure about everything. We did some body surgery, mummy makeover, rhinoplasty of any kind with rib, without rib. We still have one rib to do. Preservation, hybrid, closed, open,
All of it.
facelifts, endoscopic. The last one with the paralysis.
All of it. So it's really an educational. Aside from being fun, it's educational for me. So really loved my time in Madrid.
Would you? There's a sentence I like to summarize, which is 1, 2, or 3 takeaway message. Let's imagine you have to decide. You have to forget everything and bring 2 or 3 things in your mind back to Manila from here. Which would be?
Operating room or
Everything. Yeah, let's do something technical, something
so
like that.
if in the technical aspect, so again, like I mentioned, noses in Manila and noses in Spain may be different, but the technique is very similar. So you develop your technique, you enhance your technique, and you tailor it to your patients. That's one. Another technical thing I learned is you have to be efficient with your time. Time is really important for the doctor, for the patient, and for the team, of course. And again, the last thing I learned outside the technique is take care of yourself and everyone around you. That's really important. I think that you showed me.
I agree with you. Jobo, obviously we stay in touch. Now we are more than colleagues. Now we are friends.
Yes.
And so Jobo now it's joining to our network, so fellows and friends. As I said, this is not something I say just to be polite. I really truly believe it because our job eventually and this fellowship experience they enrich our lives.
Yes.
I was a fellow myself. I told you. And you get to know more people, colleagues, bright minds, and different environments.
Yes.
And you will bring Madrid in your heart forever, I think.
Forever. you and Madrid in my heart forever. So it goes beyond the clinic and the hospital. It goes beyond that. And you have to visit me in the Philippines.
Oh yes, I will go. I will go to Manila. I will stop to India to see our common friend, and then from India to Manila.
Yes.
Okay, Jobo, thank you very much.
Thank you, doctor. Thank you so much.
We still have a few days together, and we finished the week with some very fine surgeries.
Yes.
And all the time spent together was you're a brilliant guy, a brilliant mind, and I've always admired your positive, optimistic attitude. This is something that your patient will love it.
Thank you.
Okay.
You. And I appreciate everything, doctor. Together forever.
Yeah, sure.
Thank you.
Bye guys, we'll see you to the next video. Please listen and watch carefully to what Jobo said because it's something that, this is the truth. This is our daily in real life. Bye.
Bye.